cruise ship carrying nearly 150 passengers and crew remained stranded off the coast of Cape Verde on Monday after a suspected hantavirus outbreak killed 3 people and left several others seriously ill, according to the World Health Organization, WHO, and the ship's operator. The vessel, the MV Hondius, is a Dutch-operated expedition ship that left Argentina in early April for a weeks-long journey to Antarctica and remote islands in the South Atlantic. After several people on board became sick, the ship requested medical assistance near Cape Verde, located off the coast of West Africa. However, authorities refused to allow anyone to leave the vessel because of growing health concerns. Cape Verde's health ministry said the ship would remain in open waters for now and would not be allowed to dock while officials assess the risk to public safety. Spanish authorities later confirmed that the cruise ship is expected to continue sailing to the Canary Islands, where passengers and crew will receive medical checks and treatment. Spain's health ministry said the ship could arrive within 3 to 4 days, although officials have not yet chosen the exact port. Health officials also said doctors will decide which passengers need urgent evacuation before the ship leaves Cape Verde. The ship's doctor, who is reportedly in serious condition, is expected to be flown to the Canary Islands for emergency treatment. The WHO said investigators are still trying to determine how the outbreak started. Officials also warned that some infections may have happened through human-to-human transmission, although they stressed that this type of spread remains extremely rare. Hantavirus is mainly spread through rodents or contact with their urine, saliva, or droppings, WHO explained. In rare cases, certain strains of the virus can spread between people through close and prolonged contact.
Hantaviruses are viruses that are carried by some types of rodents. They can cause severe illness in humans, and they can be fatal. While we don't often hear about them, there are thousands of infections that are estimated to occur globally each year. People are usually infected through contact with infected rodents or their urine, their droppings, or their saliva. Human-to-human transmission is uncommon, though limited spread among close contacts has been observed in some previous outbreaks with one of the viruses, the Andes virus. WHO is working closely with authorities in Cabo Verde, the Netherlands, South Africa, Spain, the United Kingdom, and the ship's operators to coordinate actions to ensure the safety and health of all people on board, while also limiting further spread. WHO has informed all of our member states through our channels, our international health regulation channels.
One British passenger who was evacuated to South Africa on April 27th later tested positive for the virus and remains in critical condition in intensive care. Authorities also confirmed that a 70-year-old Dutch passenger died on board on April 11th, while his 69-year-old wife later died in South Africa after leaving the ship. Tests later confirmed she was infected with hantavirus. Ocean-wide expeditions said the body of another passenger, a German national, still remains on board the ship. The vessel currently carries 88 passengers and 59 crew members from 23 countries. According to the operator, passengers include 17 Americans, 19 people from the United Kingdom, and 13 Spanish nationals. 2 crew members, 1 British and 1 Dutch, are also seriously ill with respiratory symptoms and urgently need medical care. The WHO official Maria van Kerkhove said most passengers are not showing symptoms at this time, but health teams ask them to remain inside their cabins while workers disinfect the ship. Experts continue to investigate the unusual outbreak.
So I'd like to update you on the situation involving hantavirus on a cruise ship that is currently stationed off the coast of Cabo Verde in the Atlantic Ocean. As of today, 7 individuals of the 147 passengers and crew have been reported ill. Sadly, 3 have died. One patient is in intensive care in South Africa, although we understand that this patient is improving, while 2 patients are still on board the ship and are being prepared for medical evacuation to the Netherlands for treatment. In our disease outbreak news that we published late last night, we did mention a 3rd suspected case who reported a mild fever at one point, and that would make this the total of 7 cases, 2 confirmed and 5 suspected. This person, I'm happy to say, is currently well and is asymptomatic. So typically when we have these ongoing investigations, our case numbers will change. They'll go up or they'll go down. So we will update you as necessary. At this stage, there are no additional symptomatic people on board. That said, the situation is being closely monitored, and as a precaution, passengers have been asked to remain in their cabins while disinfection and other public health measures are carried out. Medical teams from Cape Verde are providing support on board the ship. We are supporting the medical evacuation of the 2 sick patients who are stable on board, and we're coordinating with the Dutch and Cape Verde authorities and the ship's operators. This is currently underway. Epidemiologic investigations are also underway to better understand the source of exposures of the suspected cases. Contact tracing is ongoing. Further laboratory testing continues.
Hantavirus infections are rare but dangerous. The disease usually spreads through rats or mice and can infect humans when contaminated dust particles become airborne during cleaning or contact with rodent waste. Symptoms can appear between 1 and 8 weeks after exposure and may include fever, muscle pain, breathing problems, and stomach-related illness. There is currently no specific cure for hantavirus, so doctors mainly provide supportive treatment such as fluids, rest, and breathing assistance when needed. The Andes strain, mostly found in Argentina and Chile, is the only known form of hantavirus that can spread between humans through close contact. The WHO said the overall risk to the public remains low, but international health experts are closely monitoring the situation. Health experts say prevention focuses on avoiding contact with rodents and keeping rooms, storage areas, kitchens, and surfaces clean. During outbreaks, contact tracing helps officials find people who may have been exposed early, provide faster medical care, and reduce further spread. Meanwhile, the Pan American Health Organization warned late last year that hantavirus cases have been increasing across parts of South America, especially in Bolivia, Paraguay, Brazil, and Argentina. That's all for now from Global Pulse Unplugged. Stay sharp, stay informed, and we'll see you next time.